We're going to talk about the bendy things in your legs, especially the knees. Dr. Nathan Skelley joining us now here from Missouri Orthopedic Institute. Thanks for filling in, because otherwise I was going to be able to talk about concussions and helmets at the wall, and so I appreciate you stepping in.
No, I'm glad to be here. Thank you very much.
Yeah, and you've been already busy. We were talking, exchanging war stories on the high school football field after week number 1, which brings us to the sports injury clinic every single Saturday morning after the Friday night lights, 9 to 10 a.m., a free clinic at the Missouri Orthopedic Institute. Doctors will be on staff, and referrals are going to be available for that. But week number 1, why do we see so many injuries?
So as a sports orthopedic surgeon, I'm very excited about this season, just like the athletes, just like the coaches. We're all excited to get back into the competitive spirit. And it was a little surprising this week. I mean, for right out of the gates, there were a lot of cramping issues, a lot of injuries, shoulders, knees. We were a little bit more busy than we'd like, on the sidelines. I think it's kind of that enthusiasm. They've been looking forward to it for so long to finally get out there. Injuries happen in these contact sports, and we saw a lot of them last week.
Yeah, and we're going to talk about our knees. So if it's, and I know we talked about a little bit about it last week with Dr. Richard Ma, who is our guest from the Missouri Orthopedic Institute. But the knees specifically, you see the linemen with their braces and all the rest of that. So we'll get to that in just a second. But for folks who aren't familiar with the structure, what is the knee joint?
Yeah, so in a basic sense, you can kind of think of it like a hinge joint, but it's actually much more complex than that. The movement about the knee is in multiple different planes, and there are multiple different structures that help give stability to the knee. So when we have athletes that are moving at high speed and they're doing cutting activities and they're at risk of getting contact injuries, the knee is a very large joint, so it's very susceptible to a lot of injuries, a lot of damage to those stabilizing structures, and that's when the trainers and the doctors get involved to help treat that.
And the parts of the knee that we were concerned about, let's start right up front, the patella and the patellar tendon.
Yeah. So patella dislocations are extremely common, especially in contact sports like football. First-time dislocators is a very difficult situation to treat. It's something that we try to treat with physical therapy, bracing, activity modification. But in certain situations, they can actually lead to surgery very early on. Chronic dislocators also frequently need surgery to stabilize the kneecap and give some stability to the joint. And
we've heard in the past, not just the dislocation of the patella, but also the tear of the patellar tendon.
Yeah. So that's a very uncommon injury when you compare it to other structures in the knee, like the ACL or the meniscus. But when it happens, that's a very devastating injury. A tear in the patella tendon means that the athlete can't extend the knees. That means they can't not only run, they can't walk. And so it's a very devastating injury, something that typically needs surgical fixation to give that extensor mechanism, that mobility to the knee back. And that's an area where surgery is very important.
Well, and I'm trying to think, there's been a couple of football players in the last 2 years where they've had pretty serious patellar dislocations that have required flight to a hospital and emergency surgery. Is that common, or is that something that is uncommon, but yet it's still an emergency?
It's a very important condition to identify, and that's a very important thing that you're bringing it up, but it's very rare. The problem is if you miss it, that can be devastating. That can have huge consequences for the athlete and their future athletic potential. So although it's rare, it's something we don't want to miss. And so that's what the athletic trainers, what the medical staff on the sidelines are checking for in any athlete that has a knee injury, is that extensor mechanism intact and functioning so they can walk, run, jump, do those activities.
All the things that the little boys and girls in the neighborhood love to do.
Absolutely.
All right. As we move on to the interior portion of the knee, you mentioned the meniscus. Kind of like that's the knee shock absorbers in there. That's so what damage, what can be fixed?
So our goal is to, in these young athletes and athletic individuals, to fix most meniscus tears. Where the patella tendons are very uncommon, meniscus is extremely common. It's one of the most common injuries we see in sports orthopedics. These cushion discs are very important for protecting the cartilage in the knee, and with athletic activities, cutting and pivoting activities, people can tear that cushion disc, and that's when we get involved to help restore that cushion.
How can you tell? I mean, a lot of it just catches and it clicks.
So it's kind of, just what you described. It's those symptoms are what we're listening for. There's not a lot of things in the knee that will cause clicking and catching and mechanical symptoms like that. One at the top is a meniscus tear.
Okay.
So when we hear an athlete complain of that's one variable we're considering. The other is swelling in the knee. So anytime a student athlete or a collegiate athlete has a swelling problem within the knee, that makes us concerned that there could be a meniscus issue as well.
And Dr. Nathan Skelley with us here. You can catch him and the rest of the doctors over at the Sports Injury Clinic on Saturday mornings from 9 to 10 o'clock every Friday over at Missouri Orthopedic Institute as everybody winds down from Friday night. All right, and then ACL, MCL, PCL. As we go around the trio of ligaments.
So these ligaments are those stabilizers that we were talking about in the knee. This is what gives us the ability to push off with the knee, to run, sprint, do the activities we love to do in a sports sense. But when we have impact injuries or twisting injuries to the knee, an athlete can tear these ligaments. Just like we were talking about the meniscus and swelling in the knee, when ligaments tear, any of these ligaments, you can also get swelling in the knee. So this is another important, very common injury that we see among our athletes in the area. It's a reason that we have the Saturday morning clinic. So anytime a coach, a trainer, a family member, an athlete notices that they have a big swollen knee, that's a clue to us that something's going on in that joint and a reason to get it checked.
That's something that ought not to be happening.
Yes,
all right,
exactly.
So we do not have a call screener, so this is kind of a roll of the dice. So we'll see what happens here. Good afternoon. You're on the closers with Dr. Nathan Skelley. All right. That was fun. We'll do that again sometime. Just make sure your phone is not in your pocket when you sit down to dial us. It makes it a lot easier for us to hear what you have going on as opposed to what's going on around you. All right, so ACL, MCL, PCL, ligaments. We talked about the patellar tendon for people who aren't familiar with the anatomy. What's the difference between a tendon and its repair and a ligament and its repair?
Oh, that's a great question. So a ligament is a band of tissue that attaches bone to bone. A tendon is a band of tissue that attaches muscle to bone. So they serve very different roles, but they're both very important structures to the function of a joint.
So what's the difference in the approach to a repair?
So that's a very complicated question, something that we go into great detail with our athletes because it depends on what type of ligament is torn, to what degree it's torn, the tendons, the same kind of issues. Is it a partial tear? Is it a full tear? I have clinics twice a week, and all day in clinic, those are kind of the questions I'm talking about with patients. Is this a tear or a stretch in those tissues that actually needs surgical treatment, or is it something that will heal on its own or need reconstruction? So it's a very complicated issue.
On a partial tear, when do you make the decision that, okay, we need a surgical intervention?
So take the ACL, for example, the most common ligament in the knee to be injured. When we get our very high-definition MRIs at the Missouri Orthopedic Institute, we occasionally do get reports back or we see partial tears within the ligament. The indication to me to treat that or go for a reconstruction or repair type procedure is if the patient has instability. So they feel the buckling in the knee, they feel it giving way. If they don't have those symptoms, a lot of times we'll slow them down, take them out of the game for a little bit, and give the body time to heal.
Okay, and now we get to our brace question. Then, with all of those ligaments, with the tendon, you and talked with Dr. Ma a little bit about this last week as well. But the knee braces that we are seeing on the collegiate football athlete, on the professional football athlete, and now you're seeing this with all the linemen on the high school level.
Yeah,
are you a proponent? Or wait till the body finishes developing and then we discuss.
In certain situations, I'm smiling
because
that's a great that's another complex question. In certain situations, the brace can be very useful. We're kind of getting into a topic of mental health aspects of an athlete returning to sport. Some athletes feel better security wearing the brace. There's some evidence to support that in an isolated ACL reconstruction, they don't need the brace. The reconstruction that we do and securing that new graft to take the place of their ACL is stable enough to compensate for it. I get a little cautious with braces and that I don't want the muscles to get weak and deteriorate because the athlete is relying on the brace more. We do the surgery to give them a stable knee so they can build up their muscles and get back to activities. So to answer your question, in certain situations, yes, but not always.
All right. So comfortably atop the fence as we exit out of that one. What are some of the exercises that you can do? And I don't care if you're an athlete or if you're just a weekend warrior or whatever, hopping up and down a ladder and then you hit that bottom step and bam, ACL is gone. What are some of those exercises that you can do to strengthen that area?
So we talked about the swelling that happens in the knee after an ACL tear. When you get that swelling, it's a natural reaction that the body wants to not use the muscles about the knee. It's painful, it hurts, so you don't want to use those muscles. The ones that we see the biggest problem in are usually the quadriceps muscles. So they can get very atrophied, which means the muscles become very weak. And so I'll typically send patients to physical therapy to strengthen both the quad muscles and their hamstrings before we talk about any surgical intervention.
So we're doing this. My ACL is gone, but I'm here. I'm working out that leg prior to surgery.
Yep. So this goes back to the point about tendons versus ligament. When the ACL tears, that's a ligament. So we're going to build up the muscles to try to compensate for the stability that the ligament gives us. It works to an extent, and if it's able to get somebody back to the activities they want to do, that's a situation where we don't typically talk about surgery. For many of our younger athletic individuals, tearing that ligament, the muscles can only compensate so well. And that's when they come and see Dr. Ma or myself, and we talk about doing a surgery to reconstruct that ligament.
How has the surgery and then the rehab and the recovery changed over just the last 5 years?
Oh, it's been dramatic. So the area of sports medicine, orthopedic surgery is evolving very quickly. The ways that we fix the grafts, the way that we position the grafts, there's been a lot of new developments that have all come from research within this area. And that's something we focus on at the Missouri Orthopedic Institute. As an academic center, we do a lot of research into how to best get these athletes back to the level of sport that they want to perform at, or even better. So it's an evolving field. We've changed a lot of the techniques and the fixation constructs, but it's an area that we work at researching every day at MOI.
Dr. Nathan Skelley with us here on The Closers from Missouri Orthopedic Institute. Again, check out their weekend clinic Saturday morning from 9 to 10 a.m. over at MOI, and it runs right on through the football season. So we are in week number 2 of this, and they are in week number 2 coming up this Saturday. Will Tom Brady play forever?
I think he's got potential. So.
I mean, were you there when he got started?
So not when he got started, but I was there for 2016 to 2017.
Okay.
I was one of the assistant team physicians with the New England Patriots, and to watch him play.
So as a Dolphins fan, are they just a dirty, despicable club like we all think they are?
From a medical staff member's perspective, they were very professional, kind. It was a pleasure working with them. That's my party line. No, he's a phenomenal athlete. I mean, to be able to work with him, see how he plays. Age is not something that factors into the equation when you're watching him play. Just a very, very. I think anybody, depending on your allegiances, your fan base, should still respect that he's a phenomenal athlete. Yeah,
I can. I was just disappointed that it wasn't him that retired last week. Again, Giselle's retired. Other people have retired. Not Tom Brady. Yeah. On the professional side of things, though, on the professional athlete, how has that changed over time? I mean, we see the high school kids. It becomes a year-round sport. On the collegiate end, it becomes a year-round sport. On the professional end, it's also a year-round sport. But that was understood because you're getting paid. But how has that changed as the lower levels have changed?
So as a sports medicine specialist, that is one of the most difficult aspects of our patient care that we have to navigate. When I transition from seeing a high school athlete to a collegiate athlete in the Central Missouri region, those two patient populations have very different goals, different objectives. Same with a weekend warrior and same with a professional athlete. One of the biggest challenges for us would actually be working with the agents. So when the agents get involved, that really complicates medical care in many ways. And so it's a delicate balance for a medical professional to kind of weigh that the interests of the athlete, which come first and foremost to me as a clinician, but also navigating the challenges with an agent.
How about the ethical side of things? I mean, you mentioned that you were assistant team physician with the Patriots. There's a lot of pressure to get an athlete back to play because he's important to my rotate, he's important to my team, and all the rest of it. How quick can he come back at? How do you handle that on the ethical standpoint? Because you mentioned the agent gets involved, the coach gets involved, the team owner gets involved. Everybody, you've got a lot of cooks in your kitchen right now.
Not to mention there are contracts as well between the physician coverage and the team. So in some situations, the physician may be getting compensated by those teams. That's another challenge. In my practice, I put the athlete first. I focus on their goals and their objectives with the injury, and I try to block out the surrounding noise. Try to focus on what that athlete problem is and how we can help them the best. It's a challenge. I mean, it's very tough on that professional level to balance all of those other inputs and noises that occur in treating a professional athlete.
How do you hit mute on the noises on the high school and collegiate level?
So that's the challenge as well. That's when we talk about the art of medicine. So there is a science to what we do in the operating room and in clinic, and then there's an art of medicine, and that's part of what we're doing on the sidelines, is trying to understand those athletes, trying to understand what other issues may be going on than just the knee that's swollen. There can also be other factors that are affecting their ability to play or their return to play.
Dr. Nathan Skelley, Missouri Orthopedic Institute, here on the closes. Again, don't forget about the clinic on Saturday mornings from 9 to 10 o'clock over at MOI, and it runs through the entire football season right up until November 3rd. Incredibly important. I want to leave on this note because it can't be understated. I know you're an orthopedic surgeon, but the concussion issues, as you see on the sideline, what are some of the markers that you look for, and then what are some of the follow-up things that need to be done the next day, the next week?
So this is a very important topic for family members, for coaches, for any staff that are involved with these athletes, and the athletes as well, for their teammates. Concussions are very difficult to identify and diagnose. Whereas I can push and pull on a knee and have a pretty good idea of what's going on, it's very difficult to look at an athlete or talk to an athlete and diagnose the severity or the type of concussion. So it's something that, as medical professionals, we take it very seriously. When we talk to the family members on the sidelines, when we talk to the coaches, we have a very high suspicion for any serious injury. There are things we can look at for memory loss, for trouble tracking with their vision, for confusion, for nausea, for sensitivity to lights. These are all warning signs that we're going to look at for a concussion. And if an athlete has that, we have a very low threshold for pulling them out of competition just to protect their health in the long term.
Okay, so folks, parents especially, be aware that, especially after that Friday night, and the clinic is the best place to get started. If you know anything that just isn't quite normal, get on in there. 9 to 10 o'clock. Again, it's a free clinic, sports injury clinic over at Missouri Orthopedic Institute. Dr. Nathan Skelley, thank you. I appreciate that.
Thank you for having me. It's a
All
pleasure.
right, you're very welcome. And do you ever wear the ring? The Super Bowl championship?
Not that often. It gets in the way in the OR.
Well, naturally, it's hard to get that glow
in
over
clinic
the top
too.
of it.
Exactly.
So is it sit up on a shelf or something?
Yeah, very secure location.
All right, very good. Appreciate the time today. So thank you. Very appreciate it.
Thank you.
All right.
You can join the conversation anytime. Call 442-8255. The Closers on KFRU and KLIK.